Good morning, everyone. Today I want to talk to you about dental porn, and I apologize for the term, or maybe I'm not apologizing for it. So, dental porn is when you spend a lot of your hours after work. Let's say you finish work at 5, you have your dinner, and you sit on your phone and scrolling through social medias, looking at beautiful before and after dental photos, sometimes videos, photos that has very high details. So you look at those beautiful veneers, those beautiful soft tissue work, and you can very, very zoomed in. Sometimes patient has like red lipsticks and you see like ice between their teeth or whatever. So those ends taking some beautiful before and afters, and you sit down and get hooked into seeing one after one after one after one after one, and it can be very addictive. But there is also benefit from seeing those beautiful before and after videos that can be very inspirational to you, but also there's a lot of damage getting hooked into this. And let me explain to you more my thoughts on that. And again, those are only my thoughts, so you can disregard them. If you find them beneficial to you, maybe it will help you out a little bit. But first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Harvey Bay in Queensland, and you can check my details below. I took it from 1 chair to 10 chairs over the course of 14 years, and we started by we were like 3 staff members. Now we're close to 40 staff members. So going back on time, when I was a student and in my final years of university and a new graduate, internet wasn't as probably as advanced as now. Social media wasn't as advanced as now. So in my time, and I'm talking about 2000, between the 2000 and 2004, in this period when I was studying, and I was back in Egypt as well, and probably the internet was a little bit few years behind some other developed countries as well. For me to access those beautiful before and afters, I would only see them on lectures when our lecturers are presenting in university, or textbooks in the library. So for me to see a beautiful before and after veneers or full mouth rehab or soft tissue work or implant work, I would have to physically go to a library, find a textbook and open it, like Art and Science of Operative Dentistry, Schillenberg, Restorative, Prosthodontics, Carl Misch, implant textbooks. I have to physically go to the library, open the textbook and scroll through and read some chapters, and then get to some before and afters while I'm reading and studying as well. But going to the internet after work and seeing this before and afters was non-existent. Even photography wasn't as good back then from memories. That it's good and bad, because why it was good, because I wasn't exposed to beautiful before and afters every hour like we have now. So the pressure on me as a student, as a new graduate, wasn't very high. I was pleased with my work as a new graduate. I thought it was good enough. The only exposure that I get to beautiful before and after was only in the textbook, so I didn't feel this constant pressure that I have to perform better. The bad side, of course, is there's a slow progression on increasing your skills in dentistry, because when you're not exposed to beautiful dentistry, you think your dentistry is good and you don't have a good comparison to compare it to, so there's a very slow progression. But I think the benefits were much higher than the the shortfall of the exposure that new grads are getting exposed to now. Now, even for me as an experienced dentist, if I get hooked on seeing those beautiful before and afters every day, so let's say I'm watching the most beautiful soft tissue surgeries every day, yes, there's slight benefits that I might, okay, maybe I need to learn this a little bit more. Maybe there's some dentists doing this much better than me. I need to go and learn. But trust me, even me, after 20 years of experience, it can get into my head eventually where you feel very low about your dentistry. You feel down, you feel like you're not good enough, and you start to question and doubt yourself. And the damage, I think, is much higher than the benefits of learning. So you have to remember that when you're seeing those beautiful before and afters, those dentists are very, very talented, very skilled. They have practiced, they have done many full mouth rehabs, many veneer cases, many soft tissue grafting. They stuffed up a lot of cases to get to that level. And usually they're posting their best, most beautiful cases as well. Even with experienced dentists, sometimes you finish cases and you finish them, they look nice, but they're not as nice as you want them to be. And sometimes you don't post those videos unless you're very honest. My advice to you, you gotta watch how you spend your time on social media looking at those beautiful before and afters. If you feel you're learning from those photos more than those photos are causing damage on you in a way that you feel negative about your dentistry, it's okay. But you can easily get dragged to the negative mindset, and if you feel you just have very low mood and you're not enjoying dentistry as much and you feel a lot of pressure on yourself, you're sad all the time, you're not enjoying going to work, watch how many hours you spend on social media, and especially how many hours you spend watching other people before and after work, even if it's in between posts, and like you might have some funny stuff then before and after, then funny stuff before and after, and try to control that. Either unfollow or mute for like 30 days, or maybe just control your time on social media as much as you can, because trust me, this will get into you eventually and the damage will be much higher than the benefits. So watch your time on social media as much as you can. Watch your time, how much time you spend looking at beautiful before and after photos, and try to find a place where you can control it and just watch it whenever you need to access certain information. But it can be very addictive, so be very careful, be very cautious, and I fall into it. And it doesn't have to be before and after. It could be as simple as business. You could be a practice owner and you look at other successful practice owners posting beautiful things about their practice culture and how their team culture is performing at the highest level, and how their numbers, they're very productive, they're making a lot of money, traveling all around the world and doing a lot of things. Again, people post usually their best moments, not their lowest moments. And if you feel you're getting dragged into this and feel bad about your business or your dentistry, just be careful. If you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and turn notifications on, and you'll be notified when I release more videos. Thank you so much for listening. It means a lot to me.